Hi everyone. I'm going to discuss some key terms for psychological testing, assessment, and measurement. So please keep in mind the following questions. What is a psychological construct? What are psychological tests? And what are psychological assessments? According to Miller and Lovler, a psychological construct is an underlying, unobservable personal attribute, trait, or characteristic of an individual that is thought to be important in describing or understanding human behavior. So, some key terms here are underlying and unobservable. So, unlike characteristics such as weight or height, we can't directly see psychological constructs. Some examples of psychological constructs are things like anger, intelligence, extroversion, responsibility, knowledge of a particular area, a person's anxiety levels, or depression. So in order to assess psychological constructs, we have to use something a little bit deeper in terms of measurement tools. We need to use psychological tests. So according to Miller and Lovler, a psychological test is a measurement tool or technique that requires a person to perform one or more behaviors in order to make inferences about human attributes, traits, or characteristics, or predict future outcomes. So some things that I wanted to point out with regard to psychological tests are, for one, these behaviors that you perform are not exactly constrained in terms of being physical actions that you would typically think of when you hear the word behavior. Conducting an interview and responding to those questions involves behaviors. If you were to administer a questionnaire to a client, a patient, or a student, you're asking them to perform, again, another set of behaviors. And it's based on those answers, those responses, that you draw inferences about their psychological constructs. And there are other psychological tests that do involve more activity and actions that are aligned with that typical description of behavior. Here are some examples of different types of psychological tests. Intelligence tests, knowledge tests, tests that assess the symptoms of autism, depression, anxiety, a variety of different psychopathological disorders, personality tests, and addiction severity, as well as ability tests and aptitude tests across the board. These are just some examples. You can probably think of others as well. And sometimes when a practitioner is working with a client, a patient, or a student, they may need to have more information than one psychological test can provide. One psychological test may provide great insight into a particular characteristic, but they may need to understand the person at a deeper level. They may need to understand the complex profile of the individual. And that's where psychological assessment comes into play. And this is going to involve pulling together data from multiple sources. Miller and Lovler describe it as tools for understanding and predicting behavior that involve multiple methods such as personal history interviews, behavioral observations, and psychological tests for gathering information about an individual. There are many times where you may need to use psychological assessments. For example, if a child's experiencing learning difficulties, the school may provide a child study. They may gather information from parents and caregivers, the teacher. They may conduct observations and then as well administer a variety of different psychological tests. Pulling all that information together provides a bigger picture understanding of the child's needs. Similarly, if an individual is suffering from addiction, their recovery needs may be complex and require more information than one psychological test could provide. Similarly, a manager or a leader in an organization, if they were a candidate for coaching, their coaching needs may be complex and require more information than one psychological test could provide. As a final example, if an individual were exhibiting aggressive behaviors or violent behaviors and there was a possibility that the person was a threat of harm to themselves or others. A clinician may conduct a full assessment on the individual, pulling together information from a variety of sources to determine the extent of that threat. So here we've talked about psychological constructs, which are underlying and unobservable, and we need psychological tests in order to assess them effectively. We've covered a variety of different examples of psychological tests and also instances where one psychological test will not provide enough information and the practitioner needs to conduct a full psychological assessment. We talked about some examples of when that would be necessary and how that may proceed. So this is just the tip of the iceberg. These are some terms that we'll be coming back to throughout the term here, throughout our course. So I want you to really study these terms to make sure you have a solid understanding. If you do find that you have questions about these terms, please keep notes of any questions that you may have, and you can ask these in my virtual office, by email, in seminar, or in the Unit 1 discussion forums. That's it for now. I'll see you guys in seminar and in our discussion forums.